If you're over 50 and you've been doing the responsible thing, taking zinc at night, maybe adding a few other supplements, hoping something finally flips back on, this opening is for you. Because here's the quiet truth nobody likes to say out loud. Most men aren't failing because they're lazy. They're failing because they're aiming at the wrong target. And if your target is raise testosterone with one pill, you can spend years chasing numbers and still wake up feeling exactly the same. Tired, flat, and frustrated that your body isn't cooperating. Tonight, I'm going to walk you through a different framework, one that's less sexy than miracle claims, but far more practical. Blood vessel health, especially the lining that controls dilation. Sleep quality, because repair happens there. Prostate bladder comfort, because waking up to pee wrecks sleep and hormones. And yes, nutrients like zinc, but as part of a system, not a solo hero. And I'll show you a simple nighttime routine using common foods, nothing exotic, that many men find easier to sustain than a cabinet full of supplements. Important note before we start. This is educational, not medical advice. If you have sudden severe erectile dysfunction, chest pain, or urinary symptoms like pain or blood, don't biohack it. Get evaluated. Now let's do what most videos won't. Slow down, explain the mechanism, and separate what's plausible from what's marketing. Zinc has a strong reputation for a reason. It plays roles in immune function, tissue repair, and hormone-related processes. So men hear zinc supports testosterone, and it becomes zinc equals performance. But that leap skips three important realities. 1. Absorption is not guaranteed. The older you get, the more your digestive environment can shift. Changes in stomach acid, medications that affect digestion, gut issues, and food timing can all influence how much you actually absorb. So, even if a label says 30 milligrams, the question is, how much did you use? 2. A tablet is not the same as food. Food doesn't just contain a nutrient. It contains a delivery system, fats, proteins, enzymes, and companion minerals that can change how your body processes that nutrient. Supplements can help in true deficiencies, but they're not automatically superior. 3. Zinc isn't the main bottleneck for many men over 50. This is the big one. A lot of erectile performance is about a single chemical messenger, nitric oxide. Nitric oxide tells blood vessels to relax and widen. That widening is what makes blood flow increase where it needs to. You can have decent hormones and still struggle if blood vessels don't respond well. So if your strategy is only raise testosterone, you might be ignoring the more common constraint, vascular responsiveness. Let me say that in plain language. If the pipes are stiff, inflamed, or not signaling correctly, turning up the pressure doesn't always give you the flow you want. That's why some men take supplement after supplement and feel nothing, because they're focusing on the wrong lever. Inside your blood vessels is a thin layer of cells called the endothelium. Think of it like the inner skin of your arteries, an intelligent surface that decides whether vessels open smoothly or stay tight and unresponsive. When the endothelium is healthy, it responds to signals and releases nitric oxide appropriately. When it's stressed by inflammation, blood sugar swings, chronic stress, poor sleep, inactivity, smoking, or certain metabolic issues, nitric oxide availability can drop. And when nitric oxide drops, two things often happen. Erections become less reliable, overall circulation can feel older, colder hands, feet, slower recovery, lower stamina. Now here's where my commentary gets strong. A lot of men's vitality content is basically a game of false simplicity. It sells the fantasy that one nutrient equals one result. But biology doesn't work like that. Nitric oxide production is influenced by the raw materials you consume, like nitrates from vegetables or amino acids like arginine, the health of your vessels, endothelial function, oxidative stress and inflammation levels, sleep quality, and even how often you move your body. So the real question isn't what pill boosts testosterone. It's what routine supports my blood vessels, reduces inflammation, improves sleep repair, and keeps hormones stable. That's a systems question. And systems questions tend to have food and lifestyle answers, not miracle bottle answers. Here's something men underestimate. Nighttime is your repair window. During sleep, your nervous system shifts, hormones follow daily rhythms, tissues repair, inflammation signals can calm, and your vascular system is influenced by recovery processes. So if you're going to build a routine, bedtime is a powerful anchor because it's consistent. Also, this matters a lot after 50. If you wake up multiple times to urinate, your sleep gets fragmented. Fragmented sleep can worsen energy, mood, appetite regulation, hormone rhythms, and stress hormones that can interfere with performance. That's why I like night routine strategies that don't only aim at erections. They aim at sleep depth and prostate bladder comfort too. Because if you can sleep deeper, you often perform better, period. Now let's talk about a practical food-based routine that targets 3 pillars: hormone support, circulation support, and prostate sleep support. And yes, this involves nuts and seeds, not because they're magic, but because they're nutrient-dense and easy to standardize. I'm going to give you a stack, but not in the influencer sense. More like 3 foods that cover complementary bases. 1. Cashews, the absorption-friendly mineral plus arginine option. Cashews are often dismissed as just a snack, but they contain minerals like zinc and magnesium, healthy fats, and arginine, which is involved in nitric oxide pathways. Here's my grounded take. Cashews won't fix erectile dysfunction by themselves, but as part of a nightly routine, they can contribute to a nutrient environment that supports hormone signaling and vascular function. Practical tips. Choose raw or lightly roasted, not heavily salted. If they upset your stomach, reduce the amount. Some people soak nuts to improve digestibility. If that helps you, great. If it doesn't, don't make it a religion. Serving anchor, a small handful. Think in the range of 10 to 18 pieces, not a giant bowl. Why not a giant bowl? Because calories are real, and weight gain and insulin resistance can push vascular health the wrong way. So we're aiming for enough to help, not so much it backfires. 2. Walnuts, the vessel flexibility and anti-inflammatory support. Walnuts stand out because they're rich in fats that many diets underdeliver, and they contain polyphenols and antioxidants. My commentary here is blunt. If you're over 50 and your diet is low in omega-3 fats and high in ultra-processed oils, your vascular system is taking a daily beating. Walnuts aren't a miracle, but they're a move in the right direction. They're also easy to implement. Make them work better. Don't burn them at high heat. Store them properly. Warm room plus time can make them go rancid. If they smell off or bitter in a nasty way, toss them. Rancid oils are not health food. Serving anchor, around 7 to 10 walnut halves, is a reasonable daily target for many men. And here's a key nuance. If you're on blood thinners or have a condition where dietary changes affect clotting risk, you should talk to a clinician. Not because walnuts are dangerous for everyone, but because individualized safety matters. 3. Pumpkin seeds, the prostate and sleep ally. Now we're talking about something men 50 plus should take seriously: prostate comfort and nighttime urination. If you're waking up 2, 3, 4 times a night, you're not just losing sleep. You're losing the hormonal rhythm and recovery that make everything else easier. Pumpkin seeds contain magnesium, often underconsumed, zinc in food form, and plant compounds that are frequently discussed in prostate support nutrition. Are pumpkin seeds guaranteed to reduce nocturia? No, but they're a sensible part of a routine aimed at better sleep and mineral support, especially if your diet is low in magnesium. Serving anchor, around 1 to 2 tablespoons. or up to 1/4 cup depending on your calorie needs. Ideally, not sugar-coated, not drenched in salt. Timing note: if you want to emphasize the sleep angle, take them 30 to 60 minutes before bed. Not because there's a magical protection effect, but because bedtime is a consistent anchor, and minerals like magnesium are commonly used in nighttime routines for relaxation. Here's a simple blueprint you can actually follow without becoming a full-time health monk. Step 1. Finish dinner 2 to 3 hours before sleep. This gives digestion time, and many men sleep better when they're not going to bed stuffed. Step 2. 30 to 60 minutes before bed. Choose one option. Option A, simple bowl. A small handful of cashews, 7 to 10 walnut halves, 1 to 2 tablespoons pumpkin seeds. Eat slowly. Don't treat it like a snack attack. Treat it like a ritual. Option B, gentler drink. If chewing nuts at night feels heavy, blend a small portion of nuts with water into a light shake. Add cinnamon if you like. Keep it modest. This isn't a dessert. Step 3. Protect sleep like it matters, because it does. Dim screens, cool room, consistent bedtime. If you snore heavily or suspect sleep apnea, consider evaluation. Sleep apnea is a silent performance killer for many men. This last point is huge. You can eat all the right foods, but if your sleep is constantly disrupted by breathing issues, your recovery is capped. Let's be honest about timelines, because hype ruins trust. If you do this routine consistently, what might you notice? Week 1 to 2, sleep may feel steadier, fewer cravings at night if this replaces junk snacks. Some men notice less nighttime restlessness. Week 3 to 4, better morning energy for some, more stable mood. Subtle circulation changes, warmth, stamina, if lifestyle supports it. Week 6 to 8, if vascular health is improving and sleep is deeper, performance reliability may improve for some men, especially when paired with walking, strength training, and stress reduction. But if you're expecting a fireworks moment on day 3, you're setting yourself up for disappointment. This is more like restoring a garden than flipping a switch. And if nothing changes after 6 to 8 weeks, that's not failure. That's feedback. You may need a deeper evaluation: metabolic health, cardiovascular risk, medication side effects, sleep apnea, prostate issues, or psychological stress. I'm going to give you the highest return advice most supplement videos avoid. Walk daily. Strength train 2 to 3 times a week. Why? Because blood vessels respond to mechanical stimulus. Movement improves endothelial function. Sedentary life makes vessels forget how to dilate. If you do the nighttime nutrition routine but stay inactive, you're trying to renovate a house without turning on the power. Simple targets: 20 to 40 minutes of brisk walking most days. A basic strength routine: push, pull, squat, hinge, a few times per week. If you're new, start tiny and build. This isn't motivational fluff. This is physiology. Quick, important cautions. Nut allergies? Obviously avoid. Blood thinners, clotting disorders? Discuss diet changes with your clinician. Kidney disease? Special mineral restrictions? Magnesium and potassium considerations may apply. Get personalized guidance. Rancid nuts? If they taste off, throw them away. Rancid oils can increase oxidative stress. Red flags that require medical evaluation: sudden onset ED, chest pain or shortness of breath with exertion, fainting or severe fatigue, painful urination, blood in urine, fever, severe pelvic pain. Your body is not a mystery box. Sometimes it's sending a clear signal. So here's the takeaway. Stop treating zinc like a magic key. After 50, the better strategy is to support the whole system: vessel lining health, nitric oxide pathways, mineral balance, sleep depth, prostate bladder comfort, and daily movement. If you want a simple place to start tonight, Do the 5-minute ritual for 30 days. Modest cashews, walnuts, pumpkin seeds, consistent timing, and protect your sleep like it's medicine. Then track 2 things: how often you wake up at night and how your morning energy and responsiveness feel over time. Because the point isn't perfection. The point is trend direction. And in the next video, I'm going to expand this into a full evening to morning blueprint. What to avoid after dinner that silently kills nitric oxide. What to do in the first 10 minutes after waking that improves circulation all day. And why most men miss the simplest performance lever of all: their breathing patterns under stress. If you want that, you'll know exactly what to do next, because tonight's ritual is step 1.